Greeting everyone, my name is PINN from UKM. The title of my thesis is the identification of dysregulated microRNA in the association between body mass index and hepatocellular carcinoma. Liver cancer is the third leading cause of cancer death in worldwide, and hepatocellular carcinoma is the most common type of primary liver cancer. Evidence has shown that the risk and mortality of HCC was associated with increased body mass index, but contradicting results were obtained from other studies. Studies also shown that the altered level of microRNA might be linked to cancer development. Therefore, this study investigated whether if there are any microRNA that link between HCC and BMI, and what is the oncogenic role of the selected microRNA. Firstly, dataset was downloaded from TCGA database and was categorized into two groups: low BMI, which is less than 25, and high BMI, which is more than 35. The clinical pathological characteristics and mean survival analysis was compared between two groups. Bioinformatic analysis was used to identify differentially expressed microRNA, predict target mRNA, identify enriched pathways, and gene ontology. Finally, the oncogenic role of selected microRNA was validated by inhibiting Hep2 cells with microRNA inhibitor and followed by wound healing and MTT assay. Results and discussion. The race, age at diagnosis, family history of HCC, and risk factors was different between two groups significantly. Mu-N3OB is the most differentially expressed microRNA and has increased expression in HCC patients with high BMI. High expression of Mu-N3OB in HCC tissue might promote HCC cell proliferation, migration, and invasion. Upregulation of Mu-N3OB might promote obesity development by promoting adipose tissue inflammation and insulin tolerance. 4,238 genes was predicted in this study, and the most enriched pathway of the targeted gene is ERBB signaling pathway, which plays a role in promoting liver cell proliferation and adipogenesis. Based on the gene ontology analysis, Mu-N3OB acts by modulating protein transcription and translation and possibly affect glutamatergic acetylserine neurotransmission. Inhibition of Mu-N3OB could reduce the percentage of wound closure and cell viability as compared to no treatment control NTC. This finding had proved that Mu-N3OB could promote the cell migration and proliferation in HCC. Similar results were obtained in glioma cells and breast cancer cells respectively. When oxaliplatin is added, inhibition of Mu-N3OB reduced the percentage of cell viability as compared to negative control and suggested that the inhibition could increase Hep2 sensitivity to oxaliplatin. This finding also proved that Mu-N3OB could induce drug resistance in HCC. The ability of Mu-N3OB in inducing drug resistance was also found in lung cancer cells. Thus, our study concluded that Mu-N3OB could play a crucial role in the oncogenesis of process of HCC patients with high BMI.